I'm a big believer in heart rate training. Some people aren't, and there's just all kinds of different ways to train. I definitely don't necessarily race or train every training run by my heart rate, but I like to go back and look at the data and see what it's telling me, what it's teaching me about my run. So, but anyway, I'm gonna start with the very basics because I'm just assuming you guys know nothing. So, pardon me if you're like, I know all this stuff. So there's several different ways to measure your heart rate. I mean, the gold standard best way is just to feel it, right? So to feel it, you count, you time it for 10 seconds, count how many you feel, multiply by 6. That's your heart rate, beats per minute. Sometimes I'll be running, you know, what I feel like is a slow pace, and I'll look down and I'm like, nah, my heart rate's crazy or something, and so I'll just stop and just make sure, because you know, watch is not always right. So unfortunately, it's right more often than not, and I'm just having a bad day or whatever. But you know, the best way is just to actually feel it. So if your heart rate, if your watch is saying like 180, and you're like, I don't feel like that. I mean, just, you know, that's the best way to get your heart rate is just actually feel it yourself. Second best is the chest strap monitor. So for my watch, I have the running chest strap, triathlon chest strap, swim chest strap, and if I was actually trying to train my heart rate, I would wear the strap instead of just the wrist monitor. It's just a lot more accurate than the wrist sensor is. I tend to wear mine like that. I just feel like it's more accurate. Sometimes it's not picking up right, so I'll twist it like that and it picks it up better. I don't know, that's totally just personal weirdness. But anyway, so third most accurate would be your wrist sensor. So just keep that in mind. If you were really wanting to train by heart rate, I would invest in a chest strap because that's just a lot more accurate than the wrist sensor, especially on like a bike or something. If you're in aero, or even just holding on to the hoods, whatever, your wrist sensors can be off on the bike. So anyway, so that's just basics about how to measure it. Normal resting heart rate is between 60 and 100 beats per minute in a healthy adult. The more fit you are, the lower that is. You know, a lot of endurance athletes are more in the 40s, 50s. You know, my resting heart rate's 42, 48, something like that. So, and you guys are probably all similar trends with that. Let's see, normally your heart rate increases with exercise. Like I said, these are basics. If it doesn't increase with exercise, then something's wrong, right? So, and then normally your heart rate, your resting heart rate will lower as you become more fit. Some things that can affect heart rate, and this is definitely not an exhaustive list, but some things that can affect your heart rate, like acute illness, say you're getting sick. You know, sometimes your runs and your heart rates will tell you that before you even feel bad. You know, you'll be doing a run where you feel okay, but your heart rate's way high, and you're like, what's going on? And the next couple of days you end up sick, and you're like, has anybody ever had that happen? Mm-hmm. Where your heart rates run high, and you're like, what's going on? And you end up getting sick. It's like that. Your heart rate is a good indicator of what's going on, even just virus-wise. Other things, acute cardiac pathophysiologies like arrhythmias or coronary artery disease or heart failure, they can all cause you know, funky heart rate responses to things. Acute and or chronic physical conditions like, psychological conditions like anxiety or depression can affect your heart rate. So if you're, you know, just super stressed at work, your heart rates might be flying a little bit on your runs, and it might just be one of those things where you have to take a step back and think, I'm gonna slow my pace a little bit because there's too much up here, you know, or just think, okay, I'm gonna let this run be hard because I know it's just because of my anxiety and not because of something, you know, physical that's going on. Medications can affect heart rate. So this is where I'm gonna circle back to this, but so when I used to teach this class in rehab, we had half our patients were on beta blockers. So something like a medication, like a beta blocker that keeps your heart rate low, you know, if you're on any kind of medication, I'm not sure, I'm not a pharmacist, but there's probably other ones too that could affect your heart rate and affect your heart rate response. So if you're on medications, some of this might not necessarily apply to you. Some of the math might, you know, you might have to think about, you know, for someone on a beta blocker, we would use just a resting heart rate plus like 30 to 40 beats per minute, because sometimes that's all they could do if you're on a beta blocker. So medications can affect your heart rate. Caffeine, you know, if you have 3 cups of coffee one morning, you usually have 1, and your heart rate's a lot higher on your run. You know, it could be that caffeine. Hydration status, if you're dehydrated, your heart rate's gonna run higher than it is if you're hydrated. So, let's see. So, calculating your heart rate range is the next. Any questions about all that stuff? That's just kind of like basics. Any questions or
Do
Yeah.
those things that artificially affect your heart rate, do they also affect the metabolic effects correlated with that heart rate?
I think so. I mean, Ray, what do you think? Or Catherine, what do you? I think so, because I mean, metabolic effects are a lot of times just math. You know, it's like, it's amazing to me how much math is in calorie burn or VO2 or, you know, any of these things. Stroke volume with your heart, it's just math formulas. And so if you've got a higher heart rate, I would think that, I have joked around, before, don't do this, but I've joked around and said, you know, I'm gonna run every single run dehydrated. That way, my resting heart rate's higher, I'm gonna burn more calories, you know, I mean, just stupid, I wouldn't really do that. But yeah, I think that if your heart rate's higher, I do think it does affect you metabolically. I don't think, if your heart rate's high because of a secondary reason like this, and not because you're working really hard, I don't think it would make you quite as like injury prone as a track workout would, you know, if your heart rate's high because you're working hard. But that's not a healthy, you know, that's not a healthy way to to increase your VO2 max just by making yourself forced dehydrated or whatever. So don't do that. But I think the answer to that question is yes, though I might do some further research on that. Anyone else with some thoughts on that?
So, I mean, just, this is for me, like, I have like, it's not just like, oh, I'm stressed, like, I have generalized anxiety disorder.
Right.
Like, you know, like, my resting heart rate is like, it can be like 86, it's just like, I'm chilling.
Yeah.
You know.
Your mind is just going crazy.
Well, not necessarily, I mean, no, it's just like, that's just, like, I mean, I go to a cardiologist because I have like, I can get really high, when I run, like it can be like 207, you know, but like, but I try beta blockers and like, it's kind of just sucks. Like all it is for me is like, I'm at my heart rate's 150, but it feels like I'm at 200. So what is the difference and what is the point?
Right.
I'd rather just be at 200 and like have a
good workout.
Have a good run, like the bridge run, my heart rate was like 207 like the whole damn time, but I PR'd, so whatever.
Well, and honestly, that's a good question, and that's where something like this, something like training by heart rate might be hard for you. And that's also where, like for me, I'm gonna get into, kind of leads into my next point. The everything, your whole heart rate data, everything that I'm about to give you rests on this one piece of information, what your max heart rate is. And your max heart rate is going to be different than his, different than hers, different than everybody in this room. So you can't do, like for us that would do, like I'm getting ahead of myself, for our rehab patients, like we would use, if we didn't have a stress test data on them, we would use the most conservative measure of 220 minus their age. So that would be stupid for you. Like that, I mean, it would just be stupid, like to try to base a heart rate training on 220 minus your age, you know, if you have something that's going on. So the gold standard of finding out what your maximum heart rate is that stress test. So if you go and you do a stress test and you get up to 210 and the doctor's like, you know, but you're fine, heart function's fine, everything's fine, you're fine, then that's what we're gonna use for your max heart rate. And, you know, I wouldn't suggest using that for just anyone, you know, but if you've had like a physician run or someone who knows what they're doing run graded exercise test somewhere and you have a 210 max heart rate, you feed that into the math formula. And then if you're at 207 at the end of the bridge run, that's probably okay. Cause like you should, in a 10K, you know, you'll see later on with the math formula, in a 10K, you're supposed to be up there at 90% your max heart rate, you know, so it can be totally fine that you're running at a 207 if we have like the medical backup to say you're okay at 207 cardiovascularly. You're young, healthy, you know, as far as I know. So young, healthy, all that. So, you know, when you can take into account, you know, individual max heart rate, everything else is guesswork when it comes to like figuring out heart rate ranges. So that's what I don't know, I was telling Catherine I should, and I can look this up if anybody's interested, but I think there's a few places here that do VO2 max tests and stuff like that on healthy individuals, like just so for this kind of purpose, for metabolic testing and, you know, to figure out, the person that I know of, they do it to figure out nutrition, like what your basal metabolic rate is and all that kind of stuff. They'll do treadmill tests. But yeah, there's places you can do it. So that would be the best way to get that data, because without that data, everything else is just kind of like guesswork. But there are ways you can guesstimate it. And these are just a few of them. Again, not an exhaustive list, but this is what I use and what I've used as a coach in the past to try to guess the max heart rate on someone so that I can figure out this data for them. So gold standard is your graded exercise test. I'm gonna start with so that's the best. The worst is these like mathematical formulas. 220 minus your age, or 207 minus point times your age. Those things are just very much guesswork, the most vague you can get. So there's 3 that I've used other than that. There's the Balky Modified Field Test, and that's a test that you can do on a track that is supposed to mock the graded exercise test, which is done on a treadmill. So the graded exercise test is on a treadmill with a bunch of elevation, and the track work is done with speed instead of elevation. And there's a specific steps to it. So there's also the book that I've used for this talk. They do hill repeats. So to go out to the bridge and do a warm up, and then they use 600 meters. But if you're going, if you go up that Mount Pleasant side of the bridge 3 or 4 times, sprint up, jog down, sprint up, jog down, sprint up, jog down. By your 4th or 5th time, your top heart rate that you get is a good guesstimate of what your max heart rate would be. So hill repeats. And then what I've done for myself before is just put yourself out there on a 5K, like I'm going to die or run this the fastest I've ever run it. And if you use your heart rate range from that, it can be a good guesstimate of your heart rate. So for me, I had a stress echo done at a doctor's office in 2006, and I was 202 is what I got to. And then my my 3rd James Allen sprint try in August at 100 freaking degrees, I was like, I'm gonna test this, I'm gonna see how high I can get my heart. I literally was like, I'm gonna see how high I can get my heart rate. And I ran as fast as I possibly could, and I got to a 198 that day. And I was telling Ray, how sometimes your data will be like, you're like 170, 170, 170, 198, 170. It wasn't like that. It was like up to a 1. So it was clear that it was not noise, it was actual, got up to a 198. So I based my heart rate range on that 198 because it's more recent than the 202. But it honestly is pretty much the same. So
what about like a 20-minute FTP cycling?
That's a good question. That might be, this is definitely not like a exhaustive list. FTP, your functional threshold power, isn't that what you should be able to ride for an hour though?
Yeah.
So I wouldn't say 20 minutes of your FTP would necessarily get you a max heart rate.
Probably an hour.
Maybe an hour at your,
yeah,
that's a good point. An hour at your FTP.
All right.
So,
God.
I know, I don't think I do an hour of FTP, My legs are hurting. My legs hurt thinking about it. So anyway, that's, all that's guesswork, and it's fun to think about. And, in a healthy individual, you do the guesswork, you get the max heart rate, you put in the formula, and you use it kind of as a guide. All right, so finding your heart rate range and applying it to your training. So I use Carbono formula. That's what I like to use. Some people just use like a percentage of your max, but the Carbono formula uses your heart rate reserve, which is your max minus your resting. So this way, to me, I'm like, the more information you have to put in the math, the more individual it is for you. So if you've got your max heart rate and your resting heart rate, then that's better to me than just using a percentage of your max heart rate. Let's see. Okay, and then my preferred training ranges. I like this book that I go by. It's called Advanced Marathoning, and this is if you look on your sheet, these are the ranges they like for specific, like your recovery run range, your general aerobic runs, your medium to long runs, marathon pace, lactate threshold training, and VO2 max training. These are the percentages that my book goes by that I like. I was just taking the coaching test a couple weeks ago, and they were talking about how like Jack Daniels, Pete Finger, all these different people have their different ranges they like to use, and they're all, honestly, if you do the math on all of them, they're all within a couple beats from each other. So it's like, kind of pick one. They've all done the research, piggyback their research, pick somebody that you like the best. That's what I did. And, they're all going to be very similar once you actually do the math. So this is just what I like to use. And then, so the reason there's a range, so like, your lactate threshold training, they give the range of 77 to 88%. So if you're a less experienced runner, a newer runner, you're going to probably I mean, lactate threshold running is really hard, so you might not even be able to get to 88% of your max and hold it there for a lactate threshold run, a 6 mile run or whatever. You know, so your less experienced runners that don't have maybe the legs or lungs or whatever to hold that top range, they might need to start more like 77%. So, and also, you know, you're given a range because of things like weather and, you know, how you're feeling that day, yada yada. So,
Do you have
Anyway.
do you have a sheet?
Oh,
I have
yeah.
a-
I'm sorry. Oh, yeah. I forgot some of you guys. So anyway, we were at the bottom right here where,
Yep, yep.
where this is what I like to use when I'm setting up heart rate raises for a coaching client. This is what I use. Okay, so that way I can say, okay, today's a recovery run. I want you to keep it. I want you to keep your heart rate here, or what have you. When I'm training personally for me, and I would take into account my client Dana. We're gonna pretend like Dana has a really hard time running slow enough for her recovery days. So for Dana, is that true? Is that true? It's possible. You know, a lot of people actually have that problem. But I would tell Dana, don't look at your pace. Put your watch on heart rate, and I want you to say less than 153. That's I think what we'll go to the actual math in a minute. But I would say for your recovery runs, because you have a hard time, you want to run too fast, and it's important for, you know, weekly mileage, but it's not important for, you know, trying to increase VO2 or lactate. It's, you know, this is your base training. So I want you to keep the heart rate low so that we can do your quality runs where they're supposed to be. So for your recovery run, maybe I'll say, I want you to flip your watch to heart rate and keep it in the 150s, low 150s. If you start inching 160, 162, I'm just using my own heart rate data in my mind right now. I don't know what yours is, but you know, if you start inching up there, then I want you to stop, take walk breaks or run slower. For me, I have to run walk. Like sometimes for my recovery runs, I can't run slow enough. I have to run walk to keep my heart rate down. But then for your, say, lactate threshold run, I might be like, okay, ignore your watch today, and I want you to run by pace. And we're gonna look at your heart rate ranges later, you know, and that way you're not freaking out by anything. And if you are higher or lower, then we can use that information later. But right now, you know, let's run by pace instead of heart rate. So that's what I would do. Like if I have somebody let's say Traci, and Traci wimps out on her lactate threshold runs all the time, then I might say, okay, for your lactate threshold run, you've got to get your heart rate up to 170 or whatever. You know, it's like I try to take into account the individual and what they struggle with when it comes to heart rate training. So definitely for me, I struggle with running recovery runs slow enough. So I always put my watch on heart rate when I do a recovery run, so that I make sure I'm not like 172 all of a sudden, and you know, because that's not good when you're just trying to have a recovery run. So anyway, all right, welcome to the next page. Okay, so the carbon formula, it's just, like I said, a lot of this is just math, which is so interesting to me. So it's your intended exercise heart rate equals your heart rate reserve, which if you remember is the max heart rate minus your resting heart rate. So that's your heart rate reserve, times the percentage of whatever you want the intensity to be for your, you know, for on this other side, whatever intensity you want for whatever workout you're doing that day. And then that equals, and then you add that back to your resting heart rate. So if you look at, like, for the case study, Traci Finley, a 44-year-old healthy, experienced runner. So if you want to just kind of look through the math, my resting heart rate's 48, max heart rate 198, and I just because that's more recent data, I just flipped to using that instead of using my stress test from way back when. I may eventually have another stress test because, you know, it's fun, and I'm just guesswork right now, but it's so close. It was so close to the stress test that I was like, okay, it's close enough. You know, if I had done this all out 5K and it said 188, I might have been like, you know, and thought, let's do a stress test again so I can make sure that I am just that much worse now than I was then. Because, you know, but anyway, so my heart rate reserve will be 150 if you do that math. And so if you go through, I'm not gonna like talk it all out, but if you go through and you can even, for yourself, if anybody's had an exercise stress test or knows has investigated what your maximum heart rate is in a educated guess kind of way, you can plug your numbers in here and figure out your ranges, or I'm always happy to do that for people. I love doing the math. I think it's fun. It's like a game to me. So if you ever want it done, you know, I'm happy to do it for you, or we can talk individually about that. But if you look, when I do the math with mine, it gives me all these heart rate ranges. And a lot of them, honestly, there's some overlay and overlapping of them. So if you look at my recovery run, it needs to be less than 153. But if you look at a general aerobic run for me, which is, you know, heart health, benefit, all that, it's not necessarily gonna make you a faster 5K runner or, you know, a longer distance runner, but it's gonna give you heart health, your basic, like, you know, general health aerobic fitness run. It's 141 to 161. So what that tells me is I'm gonna start getting benefit at a 141 heart rate. Like that's gonna be a heart healthy or, you know, exercise for me. But then my recovery runs a higher heart rate than that, which can be confusing, but it's just because, you know, you're gonna get aerobic benefit even just from going for a walk, you know? So some of them overlap just because of common sense stuff like that. You know, it's the general aerobic, you know, you can go slower and still get heart health benefit, but if you're trying to do a recovery run from training for a fast marathon, your recovery run could still be a little faster than a general aerobic run, if that makes sense. But anyway, and then you just kind of move up from there. And it's really interesting to me, like I've done this, I wish I would have brought it with me because I wrote it down at home and left it at home, but I looked back on my data from my last, like, I think 7 or 8 marathons, scrolled way back on my Garmin Connect, and I was within, like, where my marathon pace heart rate should be, 158 to 174. And it's like clockwork for me. It's like 165, 168, 164, 169. I mean, it's like right there every time. And I don't typically run marathons just for fun. Like if I'm gonna run a marathon, even if I'm not really highly trained, like for Boston this year, I was not trained for a fast marathon, but I wasn't gonna go out there and just like putz around. Like I was gonna run it to the best of my ability. And that's what I honestly, for Boston, this is another good example for Boston. I didn't want to run, like, I wanted to do the best I could in the moment. Like that's, I'm trying to always try to do the best I can for the day I'm given and what, you know, I've put into it. I put my watch on heart rate. I didn't look at my pace. I looked at the split when it dinged and I was always like, work rate, you know? But I left it on heart rate and thought, you know, as long as I'm staying under 174, then I think I'll be okay. And it is, it's like clockwork to me. Like it just really works out well for me. And maybe because I've heart rate trained for a long time and I just sort of know what I can handle, but it keeps you from slacking too much on a marathon where you're just gonna do for fun, you know? And it keeps you from blowing up at mile 10 with a 178 heart rate and then having to walk your last 6 in, you know? So to me, that was perfect for me on that day. I didn't have any pace goals, no time goals, but I always want to do the best I can. So I just flipped it to heart rate and just made sure I stayed below 174 the whole time. I mean, last 3 or 4 miles, all bets are off. If it was 185, whatever, but if you only have 3 miles to go, you know. But you don't want to be 180 at mile 11 of a marathon. If you are, then you gotta slow down because you're not gonna make it. For me anyway, with my, you know, the way I am. But, okay, so I've covered how they overlap sometimes. Any questions so far about the numbers? No? Okay. So, as far as, if I had a specific pace goal for my marathon, say I wanted to qualify for Boston and I needed to break, you know, 3:30, so I needed to be 7:55 or something like that, then I would flip my watch to pace. I mean, if that was my goal for the day, I would flip my watch to pace and I would tell myself, do or die, I'm running the 7:55 as long as I can. If I blow up, whatever, you know? Because if I have a specific goal and I want to make a specific time, then for me, I'm going to try for that time regardless of if my heart rate's 180, right? And so, you know, there's just 2 different ways to race. I don't necessarily always race by heart rate. In fact, I usually race by pace. Same goes with my training. Like if I have a lactate threshold run I need to do, say 10 miles with 6 at lactate threshold, I typically train by pace if I'm training for a specific pace for the race. So, and what I'll do is I'll do that workout and then I get home and I look back at the data. I'm like, okay, for my lactate threshold 6 miles, you know, my heart rates were here. Oh, okay, then that's probably gonna be a pretty decent half marathon pace for me because I was within my heart rate. If my lactate threshold miles were more like my VO2 max heart rate, I might be like, oh, I don't think I'm quite this fit yet, you know? And it's a great way to use it as a tool later on. So it's kind of, again, it depends on the client and what their goals are as to whether or not you're gonna train or race or whatever by pace or heart rate. What else? Let's see. Okay, what does the data tell you? Okay, so acutely, so if you're looking at your heart rates acutely and this happens to me a lot. especially in the summertime, where I'm like running and I'm gonna run an easy 10 miles, right? And I'm running and my watch is dinging like 9 and my heart rate's like 178. And I'm like, what? You know, and so that definitely, I mean, your heart rate can tell you, you know, even if you were ridiculous, that it's really hot outside today, or, you know, it's really humid out here, or, you know, you really partied last night, and so you're very dehydrated and tired, or you're getting sick, or, you know, it's like, if your heart rate's way funky for, you know, if your pace is, you know, what you think should be recovery run, and your heart rate's what should be like lactate threshold, then it can tell you lots of things. And, you know, typically it reinforces what you already know. You know, you're trying to do a training run after you stay out late the night before, you know, at a football game or whatever, and drink a bunch of beer, and it's like, yeah, you know. So a lot of it's common sense, but sometimes it's not, you know, like the day that you're trying to run a pace run, and you can't hold your pace, and then 3 days later you get sick, or whatever, you know, so it's definitely not, you know, black and white, you know, heart rate training, but it just kind of helps you learn more about your body and what's going on and what you can expect from yourself.
So I've always had a really low heart rate, and so like I just looked at my marathon, and I was an average 147,
Yeah.
and as high as 162. I
Yeah.
mean, that was the highest I ever
That
went,
highest,
and and I looked at some of my run today. I was at 146 as an average. Like,
Yeah.
does that mean I'm just not working hard enough?
No, because it all means, what it means is we have no idea what your max heart rate is, you know?
Okay.
And it's like, the entire formula rests on what your max heart rate is, and people are just different. It doesn't mean just because she can get to a 215 and your max heart rate's a 180, it doesn't mean that you're less fit than her. It just means that your body's different than her body. You know, your heart's different, your muscles are different, it beats it. You know, it's like, it's just, some people are, you know, more efficient, less efficient, just because that's how they are. Or maybe your heart size is different than her heart size. You know, if you've got like Chip with a smaller heart versus someone with Chip's size with a bigger heart, I mean, it's just gonna be, you know, with literally a smaller heart. Yeah, literally a smaller heart, not figuratively. But you know, it's just purely physiology. You know, what your max heart rate is. It doesn't mean that you're, you know,
I mean,
more
it's like,
fit,
you
less
know,
fit, or anything.
Like I hear Cindy talk about, you know, just at 160 all the time,
Yeah.
and you're talking about 170 some odd.
Yeah.
I'm like, I
Mine
can't
runs
even
high.
imagine.
Mine runs high like Sarah's and Catherine's. Mine runs high, but you know, and I've actually have a group of friends that we all heart rate train, and it's fascinating to watch everybody's data, because it's so, I mean, just on the money of what it should be. It's just really cool to me how much, it's just fun to play with the numbers. I get kind of nerdy about, you like it too, about the data, and like looking at, you know, so I have this one friend, and I'm kind of getting to this point too, but, well, I'll get to the point before I get there. But no, the answer to your question is, it means, none of it means anything without your max heart rate and your math for you. Like, you know what I mean? So,
I do.
you know, so, it would be cool to do a max heart rate test on you somehow one day, or to get a stress test somewhere and just see what your max is, and then, you know, it's.
I had a stress test recently in the last couple months. I don't recall in the conversation ever having been told what my max heart rate, but it'll be, I mean, I've got
What it
pages and pages of results, so
Yeah.
it's in there somewhere.
It's in there somewhere.
Okay.
So, no, I was wondering if it's in there somewhere. The other problem is when you go to because I have this would happen with my rehab patients. And because we had a rehab patient in there who was, you know, some 44-year-old who just had a random heart attack and was a marathon runner. I mean, we had a woman marathon runner who was 32. I still remember her name, because I was like, oh my gosh, that could happen to me if it happened to her. She was 32, ended up with a single vessel bypass surgery, and she was like, she had just run the Disney Marathon, you know, so it's crazy. So for someone like her, you know, they did the cath, which showed blockages, or they did the stress test where she had chest pain, and then cath with blockages, and then they went and she had surgery. So her stress test, I don't think they let her go to max. You know, they stopped her when she started having ischemic changes. So it would almost, like, you would have to be going into that stress test saying, I want to get to a max heart rate. Because sometimes they'll stop you early. Honestly, I used to do stress testing at Duke, and sometimes we would stop, like if we didn't know that I want a true max heart rate so I can determine exercise goals, running goals, then sometimes we'd stop them before they got to max heart rate, because we got the information we needed, so done, you know, they're kind of struggling. So sometimes we wouldn't get someone all the way to max heart rate. So, you know, it's like, you'd have to go in there and let them know that. Listen, I wanna go as hard as I can go so I can know what my healthy max heart rate is,
Right.
you know? So, in the case of this lady, you know, she started having ischemia and changes to her heart rhythm, so that's why they stopped her. So it was not, you know, she would almost have to go back and have another one after her, which we would suggest to them, like, after your surgery, you know, and after your recovery and all that, have another one like a year later, and that would be even better data, because a lot of times they'll have a stress test on their data, but they would have gotten stopped because they had ischemia or something funky happening, so instead of getting all the way to max. So, you know, that is a great question. Like, if you do want to go have an exercise stress test for max heart rate data, for you guys that are healthy people, you know, well, for me, like, when I had to go get my stress echo, it was because I was having crazy high blood pressure. Like, just all of a sudden, we were playing around at work. I worked at Duke at the time, Center for Living, and we were playing around taking each other's blood pressures, and mine was like 200/150 or something crazy, and I was like, what? Because I'd always been a runner. I had just run a marathon. It was crazy, and it ended up being that whatever birth control pill I was on was increasing my heart rate, so I had to go off that, and the blood pressure came down. But I went all the way through to the stress echo, and so they took me all the way to max, because nothing, aerobically I was fine, everything was fine, so she didn't have any reason to stop me. But so you'd have to go in and say, I don't want you to stop me, you know, until I'm like falling off the back of this treadmill. But so you may or may not have. That wasn't a great answer to the question, because you may or may not have that data in there. But anyway, but a good question. So if anyone does want to do the testing, make sure they know. I'm doing this because I want to know what my healthiest max heart rate is. Okay, so I kind of covered if you feel okay, but your heart rate is high for pace. So if you're out in your 9, 9.5, 10, 11.5, whatever is an easy pace for you run, but your heart rate's flying, and you know something's going on. Either you're dehydrated, it's hot, or you're running against a bunch of wind, or usually there's something else going on. You're gonna get sick, or something's happening. You're anxious, whatever. You're having an anxiety sort of day. If you feel terrible. If you feel terrible while you're running, you're like, oh my gosh, it's so hard, it's terrible, but your heart rate's fine. Then on the flip side, maybe you're overtraining, or maybe you have, delayed onset muscle soreness from something else, or maybe you're just tired from too many miles that week, or something else is going on. So, a higher heart rate than what you should have for a given pace can mean certain things, and then a lower heart rate from what you should have from a given pace can mean certain things too. There's certainly, people that I've talked to before that like, God, I could not get my heart rate up high enough, and it's just because they were really tired. Like the limiting factor was their legs that day. I lifted my legs yesterday, I couldn't get my heart rate up today. So it can also tell you that, okay, what's slowing you down today is not your heart rate. So if you're supposed to run a lactate threshold run, you can't get your heart rate up there, bag it that day. Do an easier runner to stop, and then try it again another day for that pace run that you're supposed to do, if you can't get your heart rate up, because typically it's for another reason. Okay, let's see. Okay, so that's acutely, like if you're looking at your data acutely while you're running. For trends over time, so if you have, okay, I put here same effort with an asterisk. So if you have the same effort with a lower heart rate, then that's your training response. If you have same effort, lower heart rate, it means you're getting fitter. But I put the asterisk there because the effort has to be this. It's like one of those things where controlled research studies. It can't be same effort if you're just like out running in your neighborhood, a similar pace, an August versus a October windy day versus that. It has to be the same effort. So I have friends who will, 72-degree gym, this third treadmill from the left, set it on this pace and this incline and run for 3 miles in August, and then 3 months later do the same thing. Third treadmill from the left, it's the same, like as much as you can make it the same situation. Run that 3 miles again, and if your heart rate's lower, which it should be if you're training, then then that's your exercise, and that's your fitness response. You're getting better, so you can adjust. You could, in your mind, oh, I'm getting better, I can run faster. Your heart rate, obviously, is gonna still be a good tool to use if you wanna still run by heart rate instead of pace. You're gonna have to adjust your pace lower if you're getting better. If you still wanna run by heart rate, your heart rate should be lower. So you can still run at the same heart rate and your pace will be faster. Does that make sense? I didn't say that very clearly. But did that make sense what I said? Okay, so if you have the same effort, again, the same effort with a higher heart rate, it just means you're detraining. Maybe you're trying to get right back into it, and you're like, God, like 6 months ago, I could run 3 miles at 160 heart rate at this pace, but now I'm like 170 heart rate. Well, it's because you haven't really trained for 6 months, you know, so that's the detraining effect. Or, you know, it could be that it could be the flip side. It's common sense. If you haven't done much, then it's detraining. If you've still been doing a lot, then maybe you're overtraining, you know, so kind of use your brain in that too. But that's kind of what the trends tell you over time with heart rate training. So I guess the general takeaway is it's just another tool to use. I don't think it's good to use anything as your 100%, I'm always going to train by heart rate, or I'm always going to train by pace. You know, it's like people kind of do two different schools of thoughts, always by pace, always by heart rate. I know people who are stringent about these things, but for me, I tend to use both of them as a tool, you know. Just more information you have about yourself on your Garmin Connect. So anyway, and it all hinges on max heart rate. So without that personalized max heart rate, then it's all just kind of guesswork. But if you ever were interested in heart rate training, then to get that max heart rate, it's just a really cool, to me, it's a really cool way to go about training. And if I look back on I actually did this recently, because when I was writing this out, I looked back on all my most recent half marathons too, and I'm telling you, it's crazy to me. It's like 174, 175, 179, 174. It's just right there where it should be. And so your half marathon, you should be able to run a half marathon at your lactate threshold pace. I should have put that on there. So you've got marathon pace and then lactate threshold pace / half marathon pace. So for me, they're just on the money every time. So, which it's almost even just more fun to look at that data later and be like, oh my gosh, that's crazy. It just works, you know, than it is to actually train by heart rate. But anyway, any questions or anything? I have had that moment where I've been, you know, trained for a half marathon and thinking, okay, today I think I've already used this example, but 10 miles with 6 at lactate threshold pace. So 10 miles at 6 miles, which should be my half marathon pace. And if I only get to, you know, I don't know, say 170 at the end of that 6 miles, I might be like, oh, maybe I could run the half marathon a little faster. And so for the next time I have that lactate threshold run, I'll try to up the pace a little bit. And this is really like when you're coaching yourself. You know, if I was coaching you, I might be doing the same thing for Dana. You know, it's like, oh, she did this lactate threshold run, but God, her heart rate was lower. Maybe I should inch it up a little bit next time. And you know, next time maybe you can't quite make the pace, or next time your heart rate flies, and I'm like, oh, well, that was just an anomaly. You know, it's just kind of just a tool to use when you're playing around with numbers.
You say marathon pace. Your marathon does not take as long as mine is going to.
Never know. Yeah.
Should I effectively be fudging the scale?
No.
No.
I mean,
okay.
you can't use these numbers because they're minor. You can't
Right,
use non-numbers.
right,
You
yeah.
can't use, I mean, this is, you know, for Chip, that they are assuming, like, this is assuming a marathon, hey, if you are trained for a marathon, whether it's 5 hours or 3.5 hours, you should be able to maintain this heart rate, is what is the general thinking on that. Yeah. I mean, again, not these numbers, but Chip's numbers.
So resting heart rate, like when I'm asleep, it can get like, then it gets like
Yeah.
65. Finally,
Right.
like should
I've gotten in the 30s asleep before. I'm like, whoa, am I dead?
Are you? Well, my dad like isn't a runner. Like he has a super low heart rate.
My dad
so-
is a runner, but has a low heart rate too. I think it's hereditary. Too.
Yeah, but so I didn't get that cheap. But like, should I go by like my very lowest, or should I go by like my average?
What I've heard is the best time to get your resting heart rate is after you get up in the morning. Though I'm like alarm, like, you know, so I don't know. But when you get up in the morning, before you get up and start walking around about your day, when you first wake up, maybe a day where you don't have to wake up to an alarm. When you first wake up, just kind of like sitting there for a couple minutes and then check it.
Okay.
So it's like an awake heart rate, but where you're truly rested. Not where you've been like running around and you sit down for 30 minutes and you're still like, you know, and you have a cup of coffee that day and whatever, and you're thinking about, you know, your mind's else, you know, but like a true, like, you've been asleep all night, you wake up, and before you really do anything, you just kind of rest and then check it. Yeah.
Okay. Thank you.
You're welcome.
She said she'd stay over there. Yeah.
Any other questions?
Thanks, Tracy.
Oh, you're welcome.
We appreciate it. It was awesome.
Yeah.